They say the tongue is the strongest muscle of the body,
which isn't true by the way.
but it is also probably the most intelligent and the most responsive organ of the body and can show a variety of signs when something goes wrong. For example, a red tongue may indicate excessive heat within the body, like a fever or hormonal imbalance, or a pale pink tongue might be a sign of vitamin deficiency. A visit to a Chinese medicine doctor and you will realize that the tongue is a part of their basic examination and the foundation for forming a diagnosis. According to Ayurveda, the tongue is not just an organ of taste but also a very important tool for diagnosis. This ancient art of tongue diagnosis can show various patterns that actually reveals the functional status of internal organs simply by observing the surface of the tongue. So when all these ancient and brilliant forms of alternative healing modalities rely so heavily on clues present over our tongue, I think it's a good idea to stand in front of the mirror, stick your tongue out, and actually observe it. Hi, I'm Dr. Sanoba Fezad Doctor. I'm a board certified dermatologist practicing integrative and holistic dermatology. And today I want to share certain clues that you can pick up simply by visualizing your tongue. So go grab a mirror, stick your tongue out, and start observing. Similar to reflexology, our tongue corresponds to different organs of the body. I want you to take a good look at the picture on your screen. You will also find it in the blog article on my website, so don't worry. But if you want, you can simply take a screenshot and save it. Now I want you to notice the different colors, textures, bumps, and any coatings present over your tongue. It is best to inspect your tongue before brushing your teeth and 30 minutes prior to eating. So first, let's understand, what does a normal healthy tongue look like. A healthy tongue is pink in color with little bumps present on the surface called papillae. It should have no cracks or some abnormal bumps or any coating present over it. If you have a tongue like that, perfect. Now let's understand the different signs and symptoms that can show up on your tongue. We will discuss the interpretations based both on Ayurveda and traditional Chinese medicine teachings, along with an amalgamation of Western medicine, because that's what I do. I integrate it all. The more I have learned, the more I realize how similar ancient healing systems truly are, and there is a lot of overlap in their beliefs and methodologies for treatment. So first, let's start with inspecting the color of our tongue. If the color of your tongue is red or bright red, then that indicates excessive heat within the body. Common symptoms that go along with it would be inflammation in any part of the body, fever, or even migraine. Even hormonal imbalances can present with a red tongue. Now, if your tongue has a reddish purple color, then that indicates poor circulation of blood within the body. There may be inflammation or infection in the body, and body aches are a very common symptom seen along with this type of tongue. Now, if your tongue is pale pink in color or bright red, but the bumps present over it, that is the papillae, are absent or missing, and the tongue surface looks very smooth, then conventionally we call this glossitis, and it can be a form of nutritional deficiency or an indication of a vitamin deficiency. It could also be an indicator of a weak immune system or lack of energy. For example, we know vegetarians or vegans are at high risk of vitamin B12 deficiency, so unless you are sure you're getting enough of it through your diet alone, make sure you supplement with it as well. Next, I want you to observe the coating over the surface of your tongue. A thick coating indicates dampness with cold mucus present within the body, and this is a reflection of poor intestinal health or digestive issues. A thick yellow coating indicates dampness with heat mucus present within the body. This means there is a deficiency of yin, and it could be an indication of infection within the body. A gray or a blackish coating may indicate a long-term digestive disorder or that something is very wrong with your body's health. And if you see a thick white coating, then this is an indication of poor circulation or possibly a yeast infection like candidiasis. Next, let's observe the shape of your tongue. If your tongue is puffy with scalloped edges, this means you'll see this kind of waviness present on the side of your tongue, or you might see indented teeth marks. Then this indicates dampness and spleen's qi deficiency. This means there is malabsorption of nutrients. So that means you are not absorbing the nutrients from the food that you're eating. And it is very commonly seen in those who have some form of stomach problems. And a very thin tongue may be a sign of dehydration. It also indicates deficiency of qi, which is the traditional Chinese basis of energy flowing through the body. So you might experience common symptoms like fatigue, or even dizziness. Another point regarding the shape, or rather the size of the tongue, is how big is it. A big tongue is traditionally called macroglossia, and what you need to observe is whether you always had a big tongue ever since you were a child, or is your tongue actually growing. So try to recollect or ask your elders how big your tongue was if they can remember every time you stuck it out playfully, and if you were born with one, then it's okay. But if your tongue is getting bigger in size, then you need to worry. If your tongue gets swollen rapidly, then this could be a sign of an allergic reaction and you must go to the hospital right away. But if you notice your tongue is getting bigger over time, then it could be a sign of hypothyroidism, or a tumor, or a condition that is releasing excessive growth hormone, or a condition called amyloidosis, which is rare, but I just wanted to mention since we are on this topic. There could be some other findings that you may see over your tongue as well. For example, if you see fissures over the tongue, this could be a sign of conditions like psoriasis or Sjogren's syndrome, but it is also good to remember that such deep grooves may develop over your tongue as you age. These are generally harmless, but they could be a sign of an underlying disease. Hygienically, if you see grooves present over the surface of your tongue, then you should gently scrape your tongue to make sure you remove any stuck food. Now, after you have tried to observe your tongue, you might see that either it is perfectly normal or there is something wrong either with the shape or the color or the size, or you could see a combination of abnormalities in the color, shape, or coating. For example, now this is just an example, but your tongue could be pale in color with a white coating present in the middle of the tongue. So if you see any form of coating or any abnormality on the surface of your tongue, then you want to localize what area of the tongue is it present in and which internal organ does that part of the tongue signify on the tongue map. So in this example, the middle of the tongue signifies the stomach. So this means you have problems related to the stomach, and since the color of the tongue was also pale in color, and we know that a pale pink tongue is an indication of nutritional deficiency, so this does make sense that there is some digestive issue happening. We are not able to absorb the nutrients, and hence you might have malabsorption or a nutritional deficiency or such other things that we need to investigate further and actually know more about. Remember, the best time to inspect your tongue is before brushing your teeth and 30 minutes prior to eating. There is a lot more that can be discussed on this topic, but I'll let you first digest the information that I've shared with you today. What I want you to do is either do it yourself, or what will be even better is do this examination with someone like your friend or family member or whoever you choose to do it with. So sit together, start the video, and go through each point one by one. If you find something abnormal or if you have doubts about anything, consult your doctor and get an opinion. Be observant and keep a regular check, since this little thing can be a window to so many underlying problems. Please like the video and share it with someone you care, and make sure you leave your questions or your feedback in the comments below. And make sure you subscribe to the channel if you haven't already, so that you don't miss out on any new video that gets uploaded. Continue to glow, thrive, and shine as always. Take care. I'll see you soon.